What if the one thing missing from your joint pain relief routine was a vitamin? Yes, a single nutrient could be the game changer your knees, hips, and fingers have been begging for. You've probably heard of glucosamine or collagen, but what if we told you that some vitamins hiding in your cabinet or your fridge might work just as fast, or even better? Stick around. Today we're diving into the #1 most powerful vitamin for joint pain, and 3 other surprising ones that deserve a place in your daily routine. Let's start with the basics. Joint pain, especially arthritis, is often driven by chronic inflammation, cartilage breakdown, and oxidative stress. And while medications can mask the pain, they rarely fix the problem at the root. That's where vitamins come in. Vitamins are more than just nice to have. They're essential building blocks that support everything from cartilage production to inflammation control. As we age, and especially past 50, our bodies absorb fewer nutrients from food. That means we need to be more intentional about what we give our joints. The problem? Most people are deficient in the very vitamins that protect their joints. And yes, this includes many multivitamin users. According to the CDC, over 35% of Americans over age 60 are deficient in vitamin D. And it's one of the most critical nutrients for joint health, and that's just the tip of the iceberg. So now let's get to it. What is the best vitamin for relieving joint pain? Let's not waste time. If you're looking for the single most effective vitamin for relieving joint pain, the answer is simple: vitamin D. And no, it's not just about bones. Vitamin D plays a much bigger role than most people realize, especially when it comes to arthritis and chronic joint inflammation. So how exactly does vitamin D help your joints? To understand that, we have to look at inflammation, the underlying cause of nearly every form of arthritis. Whether you're dealing with osteoarthritis or rheumatoid arthritis, inflammation is what leads to pain, stiffness, and swelling. Now here's the catch. Your immune system controls inflammation, and vitamin D is one of the key regulators of your immune system. In people with low vitamin D levels, the immune system tends to overreact, releasing pro-inflammatory cytokines that attack joint tissue and worsen pain. Studies have shown that seniors with low vitamin D levels are twice as likely to report moderate to severe joint pain. In fact, a 2021 review in the Journal of Clinical Rheumatology concluded that vitamin D deficiency was directly associated with joint pain severity, particularly in older adults. But it doesn't stop there. Vitamin D also helps enhance calcium absorption, which strengthens the bones surrounding your joints, support cartilage health by promoting cell growth and repair, reduce the rate of cartilage breakdown, especially in weight-bearing joints like knees and hips. Let's not forget, arthritis doesn't just affect your joints. It often leads to fatigue, poor sleep, and even depression. Vitamin D has been shown to improve mood, energy levels, and sleep quality, all of which are critical when dealing with chronic pain. Now here's the concerning part. A massive percentage of Americans, especially those over 50, are vitamin D deficient. Why? We spend more time indoors than ever before, and we wear sunscreen, which blocks vitamin D production from sunlight. Our skin naturally becomes less efficient at producing vitamin D as we age, and we don't get enough from food alone, unless you eat fatty fish and fortified milk daily. So how do you fix this? The recommended dose for most adults over 50 is between 800 and 2,000 IU per day, but your specific needs depend on your current blood levels. A simple test can tell you where you stand. Some people may need more, up to 4,000 IU day, to bring their levels into the optimal range of 40-60 ml. The best form? Vitamin D3, cholecalciferol. It's more effective than D2 and better absorbed by the body. Also, always take it with food, especially something that contains fat, like avocado, eggs, or olive oil, because vitamin D is fat-soluble. Most people report noticeable joint pain relief within 2-4 weeks of consistent supplementation. The results are often even better when paired with vitamin K2, which we'll talk about shortly. Bottom line, if you're over 50, have arthritis, and don't know your vitamin D levels, it's time to change that. This one vitamin could make the difference between painful mornings and easy movement. While vitamin D is the star of the show, there are 3 other vitamins that deserve standing ovations, especially if you want to maximize your joint relief naturally. Let's start with the cartilage hero. 1. Vitamin C, the cartilage defender. You probably think of vitamin C for immunity, colds, flu, etc., but when it comes to joint health, vitamin C is critical for producing collagen, the main protein that gives cartilage its structure and strength. In a groundbreaking study published in Annals of the Rheumatic Diseases, people with high vitamin C intake had a 30% lower risk of developing inflammatory arthritis than those with low intake. Vitamin C also acts as an antioxidant, fighting off free radicals that damage joint tissue. Here's the kicker. Your body doesn't store vitamin C. You need it daily, either from food or supplements. Best sources? Bell peppers, oranges, broccoli, kiwi, and strawberries. Or go the supplement route. 500 to 1,000 ml a day is plenty for most adults. Want to boost the absorption of your collagen supplement? Pair it with vitamin C. It works like a spark plug for cartilage repair. 2. Vitamin E, the inflammation fighter. Vitamin E isn't just for skin. It's a powerful antioxidant that helps reduce inflammation at the cellular level. It protects your joints by neutralizing oxidative stress, a major driver of cartilage breakdown and aging. In a study published in Clinical Rheumatology, patients with knee osteoarthritis who took vitamin E reported less stiffness and better joint function within 6 weeks. Vitamin E also helps protect synovial fluid, the lubricant inside your joints, from degenerating over time. The best form? Natural vitamin E, D-alpha tocopherol, not the synthetic DL version. Recommended dosage for seniors is 200 to 400 IU day. But be cautious. Too much vitamin E can interfere with blood clotting, especially if you're on medications like warfarin. Always check with your doctor. Food sources include sunflower seeds, almonds, spinach, and avocados. 3. Vitamin K2, the unsung hero. This one doesn't get nearly enough attention, but it should. Vitamin K2 works in tandem with vitamin D to direct calcium to where it belongs, your bones, and away from where it doesn't, your joints and arteries. That means stronger bones, less calcification, and healthier cartilage. In one Dutch study, participants with high vitamin K2 intake had better knee joint structure and slower cartilage loss over time. The best form is MK7, which stays in the body longer than other forms. Recommended dose? 90 to 120 mcg day, preferably with a meal. You can find it in fermented foods like natto, aged cheese, and some animal products, or as part of a D3-K2 combo supplement. So now that you know which vitamins can transform your joint health, the next big question is, how do you take them together without messing things up? Here's the good news. These vitamins work synergistically. When taken properly, they support each other and amplify results. Here's a sample daily joint vitamin routine for adults over 50. Morning, vitamin D3, 1,000 to 2,000 IU with breakfast, contains healthy fat. Vitamin K2, MK7, 90 to 120 mcg, taken with D3. Vitamin C, 500 to 1,000 ml after breakfast. Evening or lunch. Vitamin E, 200 to 400 IU with food. Plenty of water throughout the day to support joint hydration. Want to simplify it? Look for high-quality joint care packs that combine D3 plus K2 or multivitamins with C and E in balanced amounts. Important reminders, don't overdo it. More is not always better, especially with fat-soluble vitamins, D, E, K. Check for interactions. If you're on blood thinners, always speak with your doctor before adding vitamin E or K. Be consistent. Most people don't notice overnight changes. It takes 3 to 6 weeks to feel the difference, but when it kicks in, you'll know. But pair with lifestyle habits. Vitamins work best when combined with anti-inflammatory foods, light daily movement, and proper hydration. A bonus? Many users report better skin, more energy, and fewer muscle cramps after just a few weeks on this routine. And if you want to go the extra mile, add omega-3s, like fish oil or flaxseed oil. They reduce inflammation further and support joint lubrication. Remember, supplements aren't a magic bullet, but when used right, they can make your body work smarter, not harder. If joint pain has been slowing you down, now you know. Relief might not come from another pill, but from giving your body the right vitamins to fight back. Vitamin D is the foundation, but when you add C, E, and K2 to your routine, you give your joints the fuel they need to heal, move, and thrive naturally. We believe joint pain shouldn't be a life sentence. And if you agree, hit that like button, subscribe, and turn on notifications so you never miss a tip from Arthritis Relief Daily. Have you tried any of these vitamins? What's worked best for you? Drop a comment below. Your story could help someone else. Let's keep moving together.